All right, so we have a patient who just had some implants placed on the upper for all on four, and the surgeon did the case, and now we're going to come in and I'm going to create a surgical temp. We're going to start with our digital impression, and then we're going to send it to the lab for the design, and then we'll print it and deliver it tomorrow morning. So our surgeon uses Nobel, great implant. So they put Nobel healing caps on. Our workflow with the lab, works with Nobel healing caps, but I would like to go ahead and use what we typically use.
I'm assuming he drove that one pretty parallel.
It doesn't look that bad, actually.
You can still send out a 5 if you need to. It should be the third moving.
So what I'm going to do here is, because there's some soft tissue changes and changes to the palate, I'm going to put his original prosthetic back on the 2 implants that didn't change, so I can take a scan to connect everything together. Original zirconia prosthetic connected to this implant, site number, let's call it 4, and this implant, let's call it number 9. Okay, bite down for me. Bite. Bite. Open. This one.
Maybe.
I was on an iron supplement. It did not change.
We don't need to suture anything.
With caps.
Yeah, give me a second. Let me make sure I'm happy.
Were you asleep?
Mm-hmm. We need dinner.
It was dinner.
When is dinner? Yeah.
Mm-hmm.
His little belly.
I just want to know what I missed.
Nothing.
Leading a child.
We missed a professional debate in the